On this Saturday night, overwhelmed and understaffed.
They're just so maxed out that people aren't getting the help that they need.
The collapse in emergency departments across the country. Monkeypox crisis point.
I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
Why the World Health Organization was split on the declaration as the outbreak spreads in 70 countries. Plus, preparing for the Pope's visit.
He's not going to erase what happened to me, all the damage that these schools did to me.
The struggle to find forgiveness for what happened at Canada's residential schools. And a childhood dream comes true.
We have two police people here. One's a lady, one's a guy.
Following through on a lifelong plan to become a police officer.
Global National with Farah Nasser. Reporting tonight, Tracy Tong.
Good evening and thank you for joining us. Healthcare professionals are painting a grim picture tonight. Overwhelmed, overworked, and sick staff are having to contend with a surge in patients. And that's led to overcrowding, closures, and staggering wait times at hospitals right across the country. And with Canada's COVID-19 numbers on the upswing, there are fears things will only get worse. More on that in a moment, but we begin tonight with the story of an Ontario family who shared their nightmare hospital visit with our Mike Drolet.
11-year-old Macy's journey through Ontario's health system reads like a cautionary tale. Her first visit to the ER lasted 12 hours.
They send us home with no pain medication, no splint, nothing. And her arm is like 4 times the size.
At her follow-up visit 2 days later, she learned her elbow was in fact broken, and she was sent to the hospital for sick kids for another 12 hours in the waiting room. They gave her a bed, but when she went for x-rays, they gave it to someone else. It was only back in the waiting room where she learned she needed surgery.
It seems like in every part of the healthcare system, including like the ER, they're just so maxed out that people aren't getting the help that they need.
All provinces report hospital wait times differently. In Ontario, the average wait time to see a doctor has gone up from an hour and a half to more than 2 hours in the last year. And while the provincial target to admit patients is 8 hours, in Ontario, the average right now is 20.
We've been sounding the alarm about the healthcare system for a long time. It's just right now it's at a level of crisis, I think, that we haven't seen, where there's real true risks to people's health by not being able to access care.
The crisis, healthcare workers say, may have gotten worse during the pandemic, but it started long before. In 2018, the job vacancy rate in Ontario hospitals was under 4%. Today, it's closer to 9%. And no area is in more dire need than nursing, which has seen vacancies increase from 5 to 13%.
Truthfully, we're breaking down. The entire system is breaking down.
During a 6-day stretch this month, over 15,000 BC healthcare workers called in sick at least once. That's almost 10% of the entire workforce. Insiders who live and breathe healthcare have been warning of an impending crisis for years. Canadians now have no choice but to listen. Mike Drolet, Global News, Toronto.
Well, the summer surge of COVID-19 is here. Cases are climbing in many regions, but this summer, there are mixed messages on how provinces and territories should respond. And as Jamie Mauracher reports, living with COVID means Canadians face a continued risk of infection.
Angelica Cugini is spending her workday in the backyard, trying to steer clear of her family while she recovers from her 4th bout of COVID-19.
I'm definitely not scared of COVID. It's obviously a nuisance.
While testing has largely slowed, wastewater data shows cases are up pretty much across the country. That's in part thanks to Omicron's highly transmissible subvariant BA.5, coupled with the removal of most public health measures.
We should still have been encouraging people to continue wearing the mask when they're in public.
This week, Ottawa's top doctor expressed her concern and asked people to reassess their behaviors, including wearing masks indoors and outdoors in crowded spaces. But last week, Ontario's Chief Medical Officer of Health said the province had no plans to bring back restrictions. A similar sentiment heard in Quebec, despite the rise in hospitalizations there.
We do not need to reinforce public health policies or mandatory acting from for the population.
In the U.S., there have been 90 million reported COVID-19 cases since the pandemic began. And in the last 2 weeks, infections have risen roughly 16%. Statistics prompting cities like Los Angeles to consider re-implementing indoor mask mandates. In San Diego, masking is now a requirement for summer school, while New York's governor is holding off for now.
But I'm going to reserve the right to return to this policy if the numbers change.
But waiting until cases explode defeats the purpose, says this public health expert, who worries leaving it up to choice won't work.
If you don't actually put something in place and indicate to people and really sell the message, then you're not going to get anywhere.
Despite her reinfections, Kujini, who is fully vaccinated, says she would be happy to never wear a mask again.
I think it's so much better the way that we're doing it right now. I think definitely moving forward and living with the virus is important.
The path public health officials have now put us on, for better or for worse. Jamie Mauracher, Global News, Toronto.
Despite COVID surging, more Canadians are traveling again. But those hoping to breeze through airports and land borders this summer are faced with growing challenges. And one program designed to speed up service for trusted travelers is still in limbo. Nexus enrollment centers in Canada have not reopened since the beginning of the pandemic, despite American centers opening their doors 3 months ago. Sean O'Shea finds out why.
The sign has read closed for more than 2 years. Nexus enrollment centers like the one here at Toronto's Pearson International Airport still shut down and not available for all important interviews, meaning that approved Canadian trusted travelers can't get their credentials to allow them faster access to the U.S. and speedier return from international destinations.
I think it's ridiculous, still closed, and that delays in processing those applications are getting longer and longer.
We've reported on this issue before. 2 months ago, travelers we talked to were frustrated at that delay.
My Nexus expired during the pandemic, and I would like to try to renew it.
American processing offices reopened in April. The Canadian government has said it's negotiating with the United States on reopening ones here because American border officers make up part of the office staff. Now the real issues come to light. The Americans are balking at coming back because border agents want to be able to carry their sidearms inside the offices, something they're allowed to do at border crossings and at pre-approval points at Canadian airports.
Many of these Nexus offices are off-site. They're not at the airport locations any longer. So clearly the Americans are the consistency here in the American position is not surprising.
Asked about the wrinkle, the Prime Minister in Prince Edward Island said this.
It's really important that we are able to stay true to our values as Canadians.
But Justin Trudeau wouldn't directly address the sticking point, American officers carrying sidearms in Nexus offices.
There are ongoing conversations right now, and we're going to try and make sure they get resolved in a way that is acceptable to both sides.
Standing on principle here doesn't accomplish much because at the end of the day, pre-clearance is a privilege. It's not a right. This has been overwhelmingly a positive thing for Canadian travelers and Canadian trade. And so the biggest benefit here flows to Canada.
Sean O'Shea, Global News.
Well, for weeks now, the world has been watching cases of monkeypox rise. And today, the World Health Organization declared the outbreak a global health emergency, citing growing concern, especially for the LGBTQ2 community. Our Reggie Cicchini reports.
In a world exhausted after more than 2 years of being caught up in a global pandemic, a rapidly spreading outbreak of monkeypox has thrust yet another health crisis under the spotlight.
WHO's assessment is that the risk of monkeypox is moderate globally.
With roughly 16,000 cases across 65 countries, the World Health Organization now deems this a global health emergency, recommending against travel if experiencing symptoms. But it wasn't a unanimous decision. 9 members were against the designation.
Since the role of the committee is to advise, I then had to act as a tiebreaker. I consider this as a clause and no consensus by them.
The number of cases pales in comparison to that of COVID-19, but experts say the risk is no less serious. It's weighted heavily in men who have sex with men, but not exclusively. 2 juvenile cases were discovered in the U.S. on Friday. Still, the medical community is encouraging communication be kept open and honest.
We've got to alert that community and the physicians who take care of them without inducing the terrible issue of stigma.
Across Canada, roughly 700 cases have been reported, and unlike COVID, vaccines already exist, but in far fewer quantities. In Toronto, about 6,000 people have received the jab.
So it wasn't really even on my radar.
Peter Kelly, a Toronto dancer, was diagnosed in June after noticing lesions on his body. He's now part of a medical study at Toronto's St. Michael's Hospital.
I know that I wasn't the only one. I just kind of took the plunge and started to talk more openly about it.
While this virus has ravaged parts of Western Africa for decades, its global spread is worrisome.
The best way to avoid this infection is to avoid being exposed to it.
Doctors welcome the decision to declare this an emergency, arguing intervention before a disease escalates is key. Reggie Cicchini, Global News, Washington.
Coming up, how the public now views the Canadian military after multiple misconduct scandals within its ranks. Not all Canadians are confident the military can appropriately deal with serious allegations within its ranks. That's according to recent internal national defense polling conducted after multiple misconduct scandals and concerns about racism and discrimination. Morganne Campbell reports.
After months of disturbing revelations involving senior members of the Canadian military, the armed forces have been forced to look inward. And it appears the Canadian public has taken note of the military's persistent, systemic issues concerning everything from alleged sexual misconduct to inappropriate behavior and racism within the ranks.
Some of them feel at odds with where the culture has developed and also unsure that the current leadership is able to sort of steer the institution in the right direction.
The March 2022 report produced by consulting firm Earnscliffe Strategy Group was commissioned by DND to assess Canadian attitudes toward the military and found that nearly 40% of Canadians are not confident the CAF will appropriately deal with allegations of sexual misconduct, while the Canadian public continues to hold generally favorable views of the armed forces and the work they do. The report shows that support isn't blind.
I'm not surprised that the public perception right now is the way it is, because we see it ebb and flow with whatever is going on. And because the Arbor report is fairly recent.
That scathing report, authored by former Supreme Court Justice Louise Arbour, revealed a military culture that is rife with sexual misconduct, white nationalism, and racism. It also questioned whether cadets in the regular officer training programs should attend civilian universities instead of Royal Military Colleges, which Arbour says suffer from a, quote, continued prevalence of sexual misconduct. Preliminary figures from the Department of National Defense show that the proportion of women set to be admitted to the program this year sits at just 18%, far short of the 5-year high of 27% set last year.
Simply trying to adjust the numbers of men and women who are going into these colleges is going to really address those bigger issues.
Meanwhile, DND's polling also found that women were less convinced that the armed forces culture will change in the future, which could explain the low enrollment numbers being reported at Canada's military colleges. Morganne Campbell, Global News, Toronto.
A ferry that caught fire during a sailing from Nova Scotia to Prince Edward Island Friday morning, forcing everyone on board to abandon ship, is still burning, and all weekend crossings are cancelled. 182 passengers and 18 crew on the Northumberland ferry were safely taken to shore after the fire broke out before the ship ran aground. The fire has been contained to the engine room and exhaust funnels, but firefighters ended onboard efforts to extinguish the fire last night out of an abundance of caution. Passengers have been told their vehicles may not be able to be recovered. Kyiv says Russian rockets landed in the Ukrainian port city of Odessa today, less than a day after the country signed deals to allow the resumption of vital grain exports in the region. Several explosions were heard in the area in an attack that Ukrainian officials are calling a spit in the face of Turkey and the United Nations, who helped broker the new grain export agreements just yesterday. Ukraine says some of the port's infrastructure was damaged, but preparations to restart exports from the Black Sea ports are still continuing. Countries across Europe are buckling under extreme heat. On the Greek island of Lesbos, a popular beachside resort has been evacuated after a wildfire exploded in size, destroying nearby homes. Strong winds are fanning already towering flames as tourists and residents flee in small boats and buses. Last year, Greece suffered the country's worst heat wave in 30 years and is now facing another summer of raging wildfires. Ahead, the resilience and resentment of residential school survivors on the eve of the Pope's trip to Canada. Final preparations are underway with just hours remaining until Pope Francis touches down in Alberta. Officials in Edmonton are warning residents of upcoming road closures and significant delays as thousands flock to take part in the historic visit. But further east in Quebec, a First Nations community is voicing their concerns ahead of a trip that some are calling unnecessary. Mike Armstrong has their story.
This community, Ganawage, was the home of the first Indigenous person from North America to be sainted by the Catholic Church. Kateri Tekakwitha was born in the 1650s. She was canonized in 2012. There's a school named after her, a park, a hospital. She is remembered here. Also remembered, the dark chapter of the Catholic Church that was residential schools.
I don't think I'll ever be able to let it go.
Ruth Loft was taken from her family every school year from the age of 5 to 12. She still wears a cross around her neck today, but not without resentment.
They took our language, our culture, and they even gave me a number. I was a number in there. Yep. My number was 7.
The Pope's apology this week for residential schools, Loft says, comes too late.
For me, I don't want to see him. He's not gonna erase what happened to me, all the damage that these schools did to me. It's not gonna erase it. It's still here with me.
There are members of the community who will make the trek to Quebec City for the visit, but there may not be any residential school survivors.
I'm representing the Mohawk Council Ganawage.
Arnold Boye is a member of the band council. He'll be attending. His parents are survivors, and he's trying to get them to go with him, but other survivors have decided the trip would be too long and difficult at their age.
So they backed out, unfortunately, but their families will be attending.
Now, there are those who don't think other members of the community should be going, or that the Pope should be coming. They don't want an apology, they say, as much as a confession and changes.
Show me what you're gonna do. Show me how you're gonna help us. Make a move. Don't come here and say, oh, I'm sorry, bless you, my child. You know what? That does nothing for me.
The local school named after Ganawage's saint was once a residential day school run by the Catholic Church. That is something that has changed. It's now run by the community and teaches children to embrace their Mohawk heritage. Mike Armstrong, Global News, Montreal.
Next, a childhood dream comes full circle. A Vancouver man fulfills his career wish. More than 150,000 people flooded the streets of Berlin today for one of the world's largest pride parades. It's Christopher Street Day in Germany, which commemorates the riots that broke out in New York in 1969 after police raided a gay bar. It has been celebrated in Germany since 1979. The theme for this year's parade is United in Love. The Vancouver Police Department introduced its newest team member in a unique way. Our camera crew captured the surprise announcement this week, which was 13 years in the making. Catherine Urquhart explains.
It was 2009 when we told you about Amon Joanna.
who used to be a little bit scared of police.
Yeah, I was a little bit. Because I thought that, because I used to be scared because some of my parents used to tell me if you stare at the police a lot and you're walking around them and looking all suspicious, that you're going to get caught and they're going to take you.
Then the 10-year-old and his brother constructed a police vehicle and gifted it to Officer Terry Parmar and his partner.
We have 2 police people here. One's a lady, one's a guy. And the lady is driving, the guy is a passenger. And we put a little bit of details in here.
That interaction prompted Amon's interest in policing, and the two stayed in touch.
And then just come on over here.
Fast forward 13 years, and 23-year-old Amon just received news he'd been hoping for from his longtime mentor.
I'll tell you something. Okay. I know you've worked really hard for this. Yeah. For the past, I don't know how long it's been, but we're going to hire you.
Oh. It's been a goal of mine since I was very young. Probably since 8 or 9 years old when I met Terry the first time.
Amon's new job with VPD, Special Municipal Constable.
Let me be the first executive member to give you one of our VPD challenge coins.
Thank you so much.
And really proud that you're joining our organization and you're going to continue that mentorship for other generations.
This freshly hired officer was always clear about wanting to be on the right side of the law.
Good guys, because they do good things.
A little boy's positive brush with the law many years ago.
For us, my brother and I, just to kind of see that the police aren't the bad guys and they're actually very nice and they won't arrest us just for showing up and, talking to them.
All right, ready?
Yeah. A driving force behind his choice to pursue a career in policing. Catherine Urquhart, Global News.
And that is Global National for this Saturday night. I'm Tracy Tong. Tonight's Your Canada is the Signal Hill National Historic Site in St. John's, Newfoundland and Labrador. Thanks for watching. Hope you can join us again tomorrow. Have a great night.